हेलो गाइड्स, मैं अरुण कुमार चौधरी नर्सिंग ट्यूटर। आज हम पढ़ेंगे कुछ CHN की इम्पोर्टेंट क्वेश्चन जो आपके हर बार एग्जाम में पूछे जाने वाले हैं। यदि वीडियो आपको अच्छा लगे तो चैनल को लाइक, शेयर और सब्सक्राइब जरूर करें। इसी के साथ अपनी क्लास स्टार्ट करते हैं। फर्स्ट क्वेश्चन है, हेडक्वार्टर्स ऑफ वर्ल्ड हेल्थ ऑर्गेनाइजेशन WHO इंस्टीट्यूटेड इन। WHO का हेडक्वार्टर कहाँ पे है? जिनेवा, स्विट्जरलैंड। जिनेवा, स्विट्जरलैंड, इसमें जिनेवा के अंदर। और WHO इस्टेब्लिश कब हुआ था? 7 अप्रैल 1948 में। 7 अप्रैल 1938 को। हेडक्वार्टर कहाँ पे है? जिनेवा, स्विट्जरलैंड। और साउथ ईस्ट एशियन रीजन, इंडिया और न्यू दिल्ली। ठीक है, तो कहाँ पे है हेडक्वार्टर? कहाँ पे इसका? WHO का जिनेवा, स्विट्जरलैंड। ठीक है, नेक्स्ट क्वेश्चन है, द वर्ल्ड हेल्थ डे इन ऑब्जर्वर एन। वर्ल्ड हेल्थ डे ऑब्जर्वर ऑन, राइट आंसर होगा 7 अप्रैल। क्या है? 7 अप्रैल। नेक्स्ट, व्हाट इज द थीम फॉर 2024 वर्ल्ड हेल्थ डे? 2024 की वर्ल्ड थीम कौन सी है? वर्ल्ड हेल्थ थीम कौन सी थी? तो इसका माई हेल्थ माई राइट। माई हेल्थ माई राइट। नेक्स्ट क्वेश्चन, विच ऑफ द फॉलोइंग नॉट ए मेथड ऑफ हेल्थ प्रमोशन एक्सपेक्ट? तो राइट आंसर क्या होगा इसका? इम्यूनाइजेशन। कौन सा होगा? इम्यूनाइजेशन। WHO डेफिनेशन हेल्थ इज। तो राइट आंसर कौन सा होगा? कंप्लीट फिजिकल, मेंटल एंड सोशल वेलबींग, नॉट मेयरली एब्सेंस ऑफ द डिजीज इन्फर्टिलिटी। ठीक है, WHO की हेल्थ डेफिनेशन कंप्लीट फिजिकल, मेंटल और सोशल वेलबींग, नॉट मेयरली द एब्सेंस ऑफ द डिजीज इन्फर्टिलिटी। नेक्स्ट क्वेश्चन, the process of continuous progressive improvement of the health status of a population is। राइट आंसर होगा हेल्थ डेवलपमेंट। हेल्थ डेवलपमेंट। नेक्स्ट क्वेश्चन, ongoing measurements of performance of the health service refer to। राइट आंसर होगा सर्वेलेंस। राइट आंसर क्या होगा? सर्वेलेंस। राइट आंसर होगा सर्वेलेंस। Ongoing measurement the performance of the health service refer to। तो राइट आंसर होगा सर्वेलेंस। नेक्स्ट, मोस्ट इम्पोर्टेंट हेल्थ स्टेटस इंडिकेशन ऑफ। तो राइट आंसर होगा लाइफ एक्सपेक्टेंसी ऑफ बर्थ। लाइफ एक्सपेक्टेंसी ऑफ बर्थ। नेक्स्ट, which one of the following is a not socio-economic indicator? तो राइट आंसर होगा लाइफ एक्सपेक्टेंसी ऑफ बर्थ। लाइफ एक्सपेक्टेंसी ऑफ बर्थ। नेक्स्ट, द प्रिंसिपल ऑफ प्राइमरी हेल्थ केयर इंक्लूड। तो राइट आंसर होगा इक्विटेबल डिस्ट्रीब्यूशन, कम्युनिटी पार्टिसिपेशन, इंटरकोस्टल कोऑर्डिनेशन। राइट आंसर होगा ABC। नेक्स्ट, द फॉलोइंग आर द फंक्शन ऑफ मेल हेल्थ वर्कर एज ए हेल्थ टीम मेंबर एक्सपेक्ट। तो राइट आंसर होगा प्रोवाइड न्यूट्रिशन, एडवाइस एंड इम्यूनाइजेशन टू मदर एंड चिल्ड्रन। मदर एंड चिल्ड्रन। नेक्स्ट, which level of healthcare primary focus on providing comprehensive healthcare service individuals and family with their community? Right answer होगा primary healthcare। राइट आंसर होगा प्राइमरी हेल्थ केयर। नेक्स्ट, द फोकस ऑन ऑफ द सेकेंडरी हेल्थ केयर, राइट आंसर अर्ली डायग्नोसिस एंड ट्रीटमेंट, अर्ली डायग्नोसिस एंड ट्रीटमेंट। Which among the following is not a component of primary health care? राइट आंसर होगा स्पेशलाइज्ड सर्विस, स्पेशलाइज्ड सर्विस। नेक्स्ट क्वेश्चन, एलिजिबल कपल रजिस्टर इज मेंटेन एट, राइट आंसर होगा सब सेंटर, सब सेंटर। नेक्स्ट, which among the following community recommended 3-tier health care delivery system in rural India? Right answer Srivastav committee, Srivastav committee। Next, all among the following are job responsibility health worker male expect, right answer होगा growth monitoring, growth monitoring। Next, prevention of risk factor related to disease condition is known as, right answer होगा periodontal prevention, periodontal prevention। Next, which of the following not a considered the secondary prevention of strategy? right answer क्या होगा reconstructive surgery for burn patient। मेन इंटरवेंशन periodontal prevention इज, राइट आंसर होगा हेल्थ एजुकेशन, हेल्थ एजुकेशन। कुछ सुविधा जिंदगी नहीं हमें दोस्तों से प्यारी, दोस्तों पे हाजिर है जान हमारी, आंखों से हमारी आंसू है तो क्या, जान से भी प्यारी है मुस्कान तुम्हारी। पेशेवर स्कैनिंग इन एग्जाम्पल ऑफ secondary prevention, secondary prevention। which of the following not a example of primary prevention? right answer best self examination, best self examination। next, which of the following is considered as secondary prevention of strategy? right answer होगा फिजियोथेरेपी ऑफ एर्थोलेजिया, सर्जरी ऑफ फॉर कैटरेक्ट, डॉट थेरेपी ट्यूबरकुलोसिस पेशेंट। तो राइट आंसर होगा ऑल ऑफ दी अबव। हाइड्रोजाइड साल्ट आयोडीन डिफिशिएंसी कंट्रोल, राइट आंसर होगा सेकेंडरी प्रिवेंशन। लेवल ऑफ प्रिवेंशन दैट इंक्लूड स्पेसिफिक प्रोटेक्शन इज प्राइमरी। When you immunize child for measles, what type prevention are you doing? Right answer होगा specific protection, specific protection। Monitoring of blood pressure in which level of prevention? Right answer होगा secondary। Next, patient on psychotherapy, what is the level of prevention? Right answer होगा secondary। Disability limitation is which mode prevention? Right answer होगा tertiary prevention। A 18-year-old female present to the gynecology clinic her annual checkup. During the assessment of the nurse discussed the importance of obtaining pap smear test on the detection cervical carcinoma. This is an example which level of prevention? Right answer होगा secondary prevention। क्या होगा secondary prevention। Chemoparaxis is level of prevention, that is primary। A community health nursing is providing health education to diabetic patients regarding how to self-monitor blood glucose level. Which of the following level of prevention practiced here? राइट आंसर होगा टेस्टरी प्रिवेंशन। फादर ऑफ इंडियन सर्जरी इज सुश्रुता। नेक्स्ट, outbreak of disease in the community in excess, the normal extension is, right answer होगा epidemic। The constant presence of infection in a given geographical area without any external input are known as endemic। Quaternion stand for longest incubation period। Father of epidemiology is, राइट आंसर होगा जोन्सो। A person with known sign disease but may transmitted is called, राइट आंसर क्या होगा एक कैरियर पर्सन। नेक्स्ट, बेसिक यूनिट ऑफ द सोसाइटी फैमिली। टाइम इंटरवल बिटवीन प्राइमरी एंड सेकेंडरी केस नोन एज, राइट आंसर होगा सीरियल इंटरवल। सेपरेट communicable disease across a large region country refer to pandemic। Window period means time period between infection and detection of antibodies। Demonometers while calculating maternal mortality rate is total number of live births। Commonest cause of neonatal mortality in India, prematurity, low birth weight। The most common cause of maternal mortality in India, anemia। Father of Indian surgery is Sushruta। Outbreak disease in community in excess normal extension of epidemic। The constant presence of infection in given geographical area without any external inputs known as endemic। Quaternion stand for longest incubation period। Father of epidemiology is Johnson। A person with known sign disease may transmitted is called a carrier person। Basic unit of the society family। Time interval between primary and secondary case is known as serial interval. Separate of communicable disease across the large region country. The country referred to pandemic. Window period means time period between infection and detection of antibody. D monitor while calculating maternal mortality rate is total number of live births. Total number of live births. Commonest cause of neonatal mortality rate in India: prematurity and low birth weight. The most common cause maternal morbidity in India: anemia. The major cause of infant mortality rate in India: low birth weight and prematurity. Sex ratio is defined as the number of female individuals for every 1000 male individuals. General fertility rate (GFR) is number of live birth women in the reproductive age group 15 to 44 years. Maternal mortality rate definition includes expect death within 6 months post delivery. Maternal mortality ratio calculated by maternal death eggs or live birth. Neonatal death defined as death of live born neonate in the first 78 days after birth. All the following are the part of the infant mortality expect: perinatal mortality. Infant mortality rate (IMR) is defined as the number of deaths in infants under age 1 year, 1000 live births eggs or live births. Perinatal mortality rate includes 28 week first week after birth. 28 week first week after birth. All of the following are common cause of post-neonatal infant mortality in India expect: so tetanus, right is expect tetanus. Major cause of perinatal mortality is birth asphyxia. Leading cause neonatal mortality in India: prematurity and congenital malformation. All are the direct cause in maternal mortality in India expect: cardiac disease. Most common cause of perinatal mortality is prematurity. Most common cause of death in children 5-year age: respiratory infection. यदि आपको वीडियो अच्छा लगे तो चैनल को लाइक, शेयर और सब्सक्राइब जरूर करें. The number of new cases occurring in a defined population during a specified period of time known as incidence. Epidemiological trait compromise all expect: investigator. Which of the following chain infection in the correct order? तो राइट आंसर होगा सोर्स, रिसीवर्स, मोड ऑफ ट्रांसमिशन एंड होस्ट। The continuous systematic collection, analysis, interpretations, health-related data needed for planning, implementations, and evaluation public health practice is known as surveillance. Most common cause of stroke in India: cerebral thrombosis. National Family Health Survey done in every 5 years. National Family Health Survey तो 5 years. Next, the floating tip of the iceberg represent clinical cases. Submerged portion of the iceberg represent undiagnosed cases. Tip of iceberg phenomena in most apparently seen in PEM, phonetic energy malnutrition. Hard immunity is not useful. Hard immunity is not useful prevention of tetanus. Administration's ready-made antibody create passive acquired immunity. Test used for the identify the immunity state against diphtheria is right answer होगा sick test. A clinical nurse prepare the administration and MMR measles, mumps, rubella vaccine to a 5-year-old. The nurse administrator is the vaccine so subcutaneously the outer aspect of the upper arm. The vaccine that leave permanent scar in babies. BCG. Influenza H1N1 vaccine was approved in the year 2009. Smallpox was eradicated from the world in the year 1980. Anti-rabies vaccine is made up from killed virus. Which of the following vaccine most sensitive to heat? Polio vaccine. BCG vaccine available in powder form. It is constituted with normal saline. Which of the following vaccine is contraindicated during pregnancy? MMR. ओके, थैंक यू गाइड्स। यदि आपको वीडियो अच्छा लगे तो चैनल को लाइक, शेयर और सब्सक्राइब जरूर करें। Which of the following disease are a known a 6 killer disease in children? Right, diphtheria, whooping cough, measles, polio, TB and tetanus. Which of the recommended site of administration of DBT infant? Lateral aspect mid thigh. BCG vaccine is given to protect the child against tuberculosis. Smallpox vaccine was invented in Edward Jenner. Which of the following is a diarrheal prevention vaccine? Rotavirus vaccine. Salk vaccine is a killed vaccine. World Immunization Week celebrated in April last week. HPV vaccine used to prevent which among the following cancer? Cervical cancer. India's first indigenous COVID vaccine is Covaxin. The first dose of MMR vaccine is given at age of 9 months. Which of the following true about BCG vaccination? WHO recommended the next therapeutic strain in vaccine production. WHO recommended the next 1331 strain for vaccine production. Dose for OPV given birth case of institutional delivery is 0 dose. Frozen DPT vaccine should be discarded. Next, in cold chain process, war in cold rooms store vaccine up to 3 months. Measles vaccine are stored in part of refrigerator, deep freezer. OPV 70 degrees Celsius or measles 10 degrees Celsius. System of storage and transport of vaccine at low temperature from the manufacturer to the vaccination site is called cold chain. At what temperature should polio vaccine be stored? 70 degrees Celsius. Which vaccine must be stored in the freezer compartment? Polio. At the primary health center, PHC level vaccine are stored in the ice-lined refrigerator. What are reaction might occur due to tetanus vaccine? Branchial nucleitis. ओके, थैंक यू गाइड्स। यदि आपको वीडियो अच्छा लगे तो चैनल को सब्सक्राइब करें, लाइक करें, शेयर करें और कमेंट करें ताकि हम नेक्स्ट वीडियो आपको अच्छा प्रोवाइड करवा सकें। ओके, थैंक यू गाइड्स। फिर मिलते हैं कुछ अच्छे वीडियो के साथ।